and Utah, because I think I've had John on here. Yeah, Utah librarian for joining us today. I'm Dina Brown. I'm the Emerging Trends Consultant at Idaho Commission for Libraries. And part of my job is I help oversee the Make It program, which brings me to why we're all here today. So we're here today to talk about what libraries are and what they can be doing to use Makerspace resources that they have to help create PPE for libraries, health facilities, grocery stores, bookstores, wherever, anywhere that you are able to partner with someone in your community to help make PPE. So I want to start by going around and having the couple of folks that are joining me from the commission introduce themselves really quick. So I'll start with Dylan.
Hi, this is Dylan Baker. I'm the broadband consultant at the Commission, and I'm having my roof done today. So if you don't hear me talking much, that's why. Great to see you all.
And also joining us from an undisclosed location in Boise is Christina.
Hi everyone, I'm Christina Taylor. I am a Youth Services Project Coordinator, just listening in for the most part and helping take notes and etc. today.
Great, thanks Christina, good to have you on the call. And then there is a smattering of folks that I specifically reached out to have on the call today, and other folks who I know just from creeping on your social media, I know that your libraries have been making PPE, so thank you for joining as well. I want to specifically make sure that we give Erica from STEM Action Center some time, Nick Grove from Meridian Library District, Jeff Stratter from Salmon Public Library, and Kristen Heinrich from University of Idaho. So I'm gonna have Erica from the STEM Action Center kick it off. Take it away, Erica.
Thanks, everyone. It's so nice to see other people's faces. I know you keep hearing that every time you get on a Zoom meeting. It's like, oh my God, it's just so lovely not to be staring at the same three faces around my house, including the dog. So Erica Compton with the Idaho STEM Action Center, and so I know many of you on the call and or know of you, some better than others, but so I was with the Commission for Libraries and helped start the Make It at the Library project. So it's just warms my heart to its core to see that it's still going and active, and at the STEM Action Center we try to continue to support that initiative through funding in other ways. So pretty exciting for me. So we had an initiative called Idaho Makers for Equity, which was kind of our Make for All national commitment, and we looked at the kind of a month ago, saw what was coming, and pivoted that initiative to focus more on the creation of PPE for our frontline workers, broadly defined. And so we have created a website, a web page on our website where you can go to find more information on the initiative. But the general idea is, we know we have some amazing makers across the state. We know you have different equipment and skills and passions. And so how do we connect you with facilities in need? So that is what we've done. We've put a page together that has some basic information on kind of what's going on. We have resources as far as patterns and ideas for some of the materials that can be made, items that can be made. Certainly, as if you all have been out there trolling around on the internet, you know that there are literally thousands of designs, and everybody has their favorite, and everybody, you know. So we've just put a few and some links to resources. We have a place where you can register as a maker and say, hey, I'm passionate about, you know, I can print face shields. You know, create the face shields. And so you can mark that as a maker, and you can do that and say, I'm at capacity, I already have people taking mine. We still would love to have you register, because that still allows us to track what you're doing and also share the story more broadly. We've gotten quite a bit of press across the state. Three of our media partner news stations have done TV shows. What am I trying to say? have done news programs on it. We have 2 PSAs that have been created to go statewide, and we've had a couple of North Idaho, public radio, etc., Twin Falls. So we really love to hear the stories, because then we can make it much more personal for your communities, and actually even specifically reach out to your communities and find press to highlight the work you're doing. So if you just register anyway, but if you have the capacity to do more of what you're doing for other facilities, the other form on our page is a form where facilities can say, hey, I am AAA home health care and hospice, and I need 30 face shields, I need 150 sewn masks with pockets for filters. And then I can find the maker who can connect you. I'm like a little matchmaker lately. It's my job 24/7 is to matchmake. It's kind of fun. So that's kind of the gist of what we're doing. We also have a small grant open. So if you look at that page, it's called Idaho Makers Unite. If you look to the right of the page, there's a place where you can log into the grant portal and apply for grant funding. It's kind of from $250 to $2,500. I'll say we are, I've just bumped up the budget again today with Angela's approval. I think we've put out about 21,500 so far, which is super. And I've kind of got the bucket up to about 35,000. So the 2,500 is kind of being reserved for organizations that are have a larger project where they've kind of got a coalition of people working together. But small libraries and individuals can apply for 255, 750, and to try to offset material costs as well as shipping, because obviously we need stuff across the state. So I have people, Nick's been shipping, you've been doing local. Adam Day in Twin Falls is shipping them all over the state for me, the face shields that he's creating. So, so that's the gist of what we're doing. And we would love you to register on the site, or even more importantly, reach out to your community. If you have police, EMT, ambulance, we had natural grocers, grocery store reach out and said, none of our checkers have masks. Well, they are an essential worker right now. We have to eat. So we got those to 2 locations in Coeur d'Alene and Haley. So hospice, nursing homes are in desperate need from what I hear. So please, if you have the capacity to reach out to your community and let them know we are here to help, have them go and submit that very short form on the website. It comes directly to me, and I try to get back to people pretty quickly and find makers. So.
Awesome. Thank you, Erica.
Yeah.
So I've put in the chat a link to the website that Erica was referring to. I also put the hashtag in there that Erica has been asking folks to use, which is hashtag Idaho Makers Unite. So if you are posting on social media about what your library is doing to help make PPE, please use that hashtag. Erica will greatly appreciate it. And as she said, that'll help her gather those stories. And so as the person that monitors the Make It at the Library Facebook page, as I see y'all posting about those, I am also trying to be good about adding that hashtag on there and tagging appropriate folks to make sure that your story gets out there and spread much more broadly. Are there any questions?
I appreciate you doing that.
Yeah, happy to. Are there any questions for Erica? And I saw in the chat that Tanya said that your library has received one of those grants. Would you be able, yeah, I know, yay! Would you be able to talk at all about what that process was like for you? Erica can plug her ears if she needs to.
No, that's just it. So I have never applied for a grant before. It's always been on I need to start looking into doing that. And
you do.
The process was so easy. I think she spoiled me for future grant applications.
I actually probably did, because they're not all that simple. And I will say, I should clarify or just add a little bit. So I am reviewing the grants multiple times a day. I try to alert almost immediately if you've been approved. And then what's happening is Stephanie Lee in our offices, every Friday, she is then processing those grants, sending out the grant award agreements. But so you'll get an email from me saying, I've approved your grant, you're awarded. Often I can't give you the full amount because we just are trying to spread it, but you know, you may apply for 1,000 and I'll say we can do 750 at this time. I try to let you know that immediately so that if you have to make purchases, you can go ahead knowing on my word that you have that funding coming, as long as you sign the paperwork and get everything back to us so that you can pre-purchase and use that as reimbursement. For schools, libraries, etc., we're okay if you use some of that funding for actual equipment. Typically, it's more for the materials. I mean, we've had some individuals reach out and go, I want a new 3D printer and a sewing machine. And we have not been able to approve those requests because I can't, you know, it's kind of a short-term project and then we've given all of this money to some individual. But for schools and libraries, if you really needed a piece of equipment that made sense, and we saw the longevity of that piece of equipment in your facility, that might be approved. But mostly it's for material costs and shipping, to offset shipping if we ask you to ship stuff off, or if you're already shipping on your own. And these grants are not tied to you having to be listed as a registered maker and supporting, you know, connecting with our facilities, but certainly we would appreciate that if you have that capacity. The biggest need right now is sewn masks, honestly. I know everybody wants to use their 3D printers and print 3D printed masks. The challenge I have heard is that it's a couple things, is that it's challenging to get the fit proper so that they really seal correctly. The PLA typically, which is people are using, you know, has a lower melting point. So there's issues around forming it to the face. The Montana mask is the one that a lot of people are using, and the new website they've put out is phenomenal, but but there are challenges. I would say that a well-sewn double ply fabric mask out of quilter's cotton that has a pocket for a filter is probably going to be more effective and more versatile for most of the people out there. 3D printers, a lot of people are using the mask extenders. So those go around the back to pull the elastic off the ear. So people that are wearing these, you know, 15 hours a day don't get little sore ears. So those are pretty popular on 3D printing sites, or for people that have 3D printers. But sewn masks, face shields, and God, if somebody knows how to sew gowns, I'm getting a ton of requests for that, and that is not one that I have been able to fill in any way at this point. So just a little more information of what I'm seeing.
Thank you for passing that along. So, and thanks for sharing your experience, Tanya. It looks like Kathy in Oneida also had a positive experience. 3D printer was too small, and we found that our extended straps for the masks works well on our Glowforge and acrylic. Nice. So even if you've got a smaller print bed, you might be able to use that tool as well. So kind of,
you know, and sorry, just about that, because I've been printing the surgical the extenders. You can scale those pretty easily. Like my FlashForge is a pretty small bed, and I scaled them. If you're using the kind of the common one, I should just go grab some. They're right behind me. The common one, I'll go grab. I think you can scale it like, Jeff, you may remember, because I think you talked to somebody about this, but like 92%. There's one you can scale slightly, and I have now can print 6 on the small FlashForge bed.
85.
So there's
85%.
85%. Oh, you're right, because there's another mask. I tried a different file and I was able to tweak it only slightly and get it on the bed, but I like that one better. So yeah, 85% scaled uniformly.
Thanks, Erica. So if you have other questions for Erica as we move forward, feel free to drop them in the chat, or we'll hopefully have some time for general Q&A at the end. But I want to check in with Nick from Meridian Library District, who has also been working with Albertsons Library, is my understanding, on kind of creating an initiative that has been spreading here in the Boise area.
Thank you. So we've been working with BSU and the BSU library and their engineering department. And we have printed several of the headbands. The BSU team modified some of the designs that were out there, and we're using their version of that now. I'm gonna turn off my notifications. And so we've been printing that. I know our library has submitted, I don't know, like 70 some there. But now we have kind of a stockpile ready to go. We've been working with Erica in the last few days to identify some of the other community needs, and we'll be reaching out to them tomorrow morning to get those out. So we are doing the shields. Oh, big flaw of the virtual background, it erases everything. Let me turn that off. There's my bed. So we've been printing these, and the hardest part for us right now is getting the shields, but we're working to coordinate that right now. The version that BSU made has a closed top, which was a piece that the St. Luke's Hospital had requested because they did not like the open portion of the printed headband. And so the BSU team had created a modified version that was closed, but it also had the printed headband so that we did not need to use elastic, which allows for allows for us to not need as much material outside of the two pieces to create a finished product, which is nice. It simplifies the kit making aspect. So what we are doing now is we're getting everything printed, figuring out the shield piece, and then wiping them down with alcohol, putting them in gallon bags, and getting them distributed. We also have lots of ear savers ready to go. Currently, what we are doing is we've kind of split off from the BSU group, which is being organized a lot through Slack right now, and there's, I don't know, 168 people, I think was the last I looked at it, that were on that Slack channel. It's very muddied in terms of trying to follow the conversation on there. So what we've done this week is separated out a specific channel for public libraries in the Treasure Valley from that Idaho Makers group, and it allows us to communicate with just the public libraries in our area so that it's not as congested in terms of communication, and we're working together with all of us to coordinate efforts in the Treasure Valley through the public libraries here, so that we're not all trying to do all the things, which is really kind of, a lot of the issues that we're seeing is everyone is trying to run forward as fast as they possibly can and not necessarily seeing what other people are doing, or they are, but they're kind of coordinating, but not really. And so really the biggest impetus for, us kind of pulling this together is that we want to make this simplified to best meet the needs of our communities. And if we're all trying to do similar things but slightly different, it's going to be harder. If we can simplify for the back end, just like who talks to who, how do we, funnel some of that information so that it's coming from, single sources, and then kind of going out from there, it makes it easier. So working with Erica has been helpful this last couple days to help our efforts here. We kind of slowed down on the face shield piece because the initial order for St. Luke's was 1,000, and as a group, I think we've hit that or close to hit that. And so we kind of migrated over to the ear savers, and now we have a stockpile of those, and we're finding more need for the face shields again, and so we'll be ramping that back up in the next couple days here. Some of you that I talked to just the other day might not have known that, but that's the plan for public libraries in our areas to ramp back up on those face shields, and so we'll be doing that. In terms of ear savers, I know I personally have like 1,200 sitting at my house ready to go out. So those are bagged up and ready to go for Treasure Valley people. So if you hear of needs of those, you can shoot me an email and I can get those out. Those are quick and easy to print if you guys haven't printed those. I know that on our machines, we're using Ultimakers mostly at my house, and then Travis has a Prusa that he's using. But on the Ultimakers, I have 2 of them running 0.8 nozzles, and that prints the ear savers very well, and it allows us to print 6 in an hour. So I can print about 15 to 18 hours a day, and get 200 of those made and 5 shields made, but I'll be changing that. So we'll probably be, I know I have 4 printers set up in my garage, and so I think I can probably get out 20 or so shields a day, maybe a little bit more if I push it. And I'm going to learn how to use my laser cutter this weekend. So wish me luck in not burning down my garage.
Yeah, that'd be bad timing. I do not want to read about you in the paper. Thanks for sharing that, Nick. A couple of things kind of percolated for me as you were talking about that. One, I love the idea that, and seeing that Jeff also posted that it looks like there's a Facebook group so kind of creating local communication groups for people that are interested in this initiative. As someone who works at the state level, though, I'm wondering, would it be useful? So I have been working with Jennifer Redford on trying a listserv option that allows us to have listservs that are more specific than just the Live Idaho, where you send it to everyone and their mother. And so you may have seen where Jennifer put out a request for people who are interested in youth services listserv. I'm wondering, would now make, and this was part of my evil plan in working with her, of creating a Makerspace listserv that's a subset of Live Idaho. So that could be a place where folks across the state that are working with this stuff could jump in every once in a while, share ideas of things that you're printing that are working. Yes, Jen's is teen specific. So what I'm getting at, Christina, is that Jen was our guinea pig, and then our phase 2 was that I was going to create a Makerspace one, which a couple of weeks ago seemed like a super low priority. But now I'm wondering if that makes sense. Can I get just a thumbs up or a yeah from people on the call? If yes, please do that so that we can all communicate. Yeah, not so much, because I'm already getting way too much email, or that's a terrible idea. Okay. All right, I'm kind of all over the place. All right, I'll think about it, but I won't go and do it today.
Hey, Dina, can I just say something real quick?
Yeah, please.
So I just put in the chat. So there's about 15, I'm looking at my email because I got every single one of them, Facebook groups that are called the COVID mutual aid groups. You may have already been in them, but Kootenai, Blaine, Bannock, Canyon, about 6 for the Ada area, 7, 8, Magic Valley, Idaho Southeast, Gooding, Payette, Fruitland, Shoshone. I mean, they're just every single one.
Mm-hmm.
So those are very specific about COVID-19, and that's a place where a lot of people have been sharing ideas. I mean, there's one south for the Boise Bench, there's one for the North End, but then there are more of them are by county or groups of counties. So I highly recommend looking there for yours. If you have a question about yours specifically, just email me and I can send you the direct link to those. You just click join the group. You just, acknowledge you're going to follow the rules and not be mean. And typically you're right in there. So I'm planning after this just to sit and systematically post in each of those groups. I've kind of done it spottily, but here's who we are as a state agency. This is how we can support you. But for information and connecting with others, it's a great place to go.
That's awesome.
Then there's an international one that it connects out to as well. So there's a massive one, this mutual aid group that is worldwide.
Awesome. So next, I would like to pass it over to Jeff Stratter over in Salmon, and if you could talk a little bit about how you've been working with making PPE from also your house, but with library equipment.
Yeah, sure. Thanks. So our community is a little unique in that we're obviously very remote and isolated and tiny. And fortunately, we have no confirmed cases yet in our county, which gives us more time to prepare and approach this problem a little bit differently than maybe some other folks. We got started over a month ago, and it's been really amazing to see how the community has come together and created local subgroups to deal with seniors, food, and all sorts of different areas, and break that down on Google spreadsheets really quickly and mobilize. And one of those groups was the PPE group, which I joined, and like everybody, it was like, cool, what can I 3D print to save the day? But quickly realizing obviously that's not the need often, and talking to your local healthcare providers and what they actually need. So anyways, we had probably about 80 members in our Facebook group that are sewing masks. They've sewn over 2,000, probably more now, masks just locally here. That's, you know, a talent that they all have and is popular. So I thought that I could just do the face shields because that's where it made most sense for my community. I did try the Montana mask in the beginning, realizing that wasn't the best solution. Obviously, we have sewn masks, but I printed, gosh, since we got started over a month ago, I had time to print every prototype that was out there and sample every prototype. And like Nick showed, you know, one of the big complaints was with the ones that don't have the protecting gear. I mean, there was ones like this one, which was kind of interesting, that had some type of movable one, which Nick's laughing because he probably saw that one out there. There's one, you know, that just has a brim, but now it doesn't become flexible. Anyways, I tried many different options. I settled on one that was on the NIH website, which has more of a visor protector and is clinically proven to, you know, they approved it to go to hospitals. Something I am using the, you know, buttonhole elastic, and thanks for Erica for sending some more of that, because this is apparently gold now and you can trade it for high dollar value. We wanted to go, or I wanted to go with something that was more quality over quantity, again, because we're only providing locally here. So I wanted people to reuse their shield over and over and over again. So I am doing it out of PETG plastic, which is easier to sanitize and going down that road. I did include, you know, more of a foam insert that provides more comfort over time, that can be removed quite easily, and providing extra foam strips for them to change out. I'm providing extra shields for them to change out when they want to change out shields. So really trying to make them have one headset that is able to be used in many different scenarios. It's a little slower production, but again, we have the liberty of having that time to be able to get them out to our healthcare providers. There are some other cool designs, that something people haven't talked about, which I'll just bring up. I mean, it might not be practical for everybody, but I thought it was a cool solution that I printed out. We haven't really used it, but there are these kind of door handle attachments that you can attach and use your forearm or arm to open up doors instead of grabbing the door handles. It might not be practical for everybody, but just letting people know that that design is out there too. And they have every different version of that for square doors or round doors, heavy doors, light doors, etc. So those are some of the things that we've been working on in Salmon.
Awesome, thanks for sharing. And I like the idea of having more of a long-term impact, especially not knowing how long this is going to be going on for, and talking about the different material types, which I think Erica touched on a little bit, as far as that's an important thing to know, is what are the, thinking about the filament that you have available to you and what are some of the properties of it, and realizing that if you're printing things that are going to be reused, they're going to need to be washed and sanitized. And I know that Boise State has been recommending PETG for the reason that you mentioned, that it's easier to sanitize.
Real quick, Nick, just want to say also, for as far as materials go, this was what was, because I had a hard time finding face shields as well, and I bought every different kind of plexiglass under the system, you know, to try all the different kinds. Used lamination pouches. I went through the whole gamut. The one that was on NIH's website, and I think they took it down because Amazon was probably getting hammered, but I got a bunch before they went out, were just kind of these Avery book binding. I mean, there's the actual number of that template. I can put a link in there if you want. I don't know how many, but these seem to be the clearest and work really well. And they're cheap enough to order a bunch. So just thought I would throw that out there.
Thanks. That's awesome, because I found some of those at the library when I was hunting through trying to find stuff yesterday. So I will go back and steal those, borrow those, take those, whatever. They will be coming home to be made for our near-term use. I'm talking about that. I started using the laminate sheets that we have. I'm going to test that out today to try and get us some quick turnaround. But in terms of filament, I know that we started off doing the PETG stuff early on, and we were running into a lot of issues with it just from having to baby it to get it to go through. So BSU had talked to St. Luke's, and they were okay with people using PLA and ABS. So if you have that on hand, don't let that be the impetus for you not printing. Especially if they're single use versus multiple use. We can, if that's all you have, by all means, still make with PLA to keep the process moving. I know that, like I said, the PETG can be difficult on a lot of machines and has some unique restraints on being repetitive on some of the machines that we have. So keep that in mind.
Cool, that's good information. Yeah, Erica.
Yeah, I was just going to add in one of the biggest challenges, just even from me starting, I don't know, 3 weeks ago, is just this moving target of what's acceptable and not. It's been, I mean, the COVID-19, the national group or Facebook has really been good about posting NIH CDC guidelines. And also there's an NIH 3D print exchange that they post approved and or clinically tested prints. So you can find that. So that's really valuable. I mean, there's just a ton. Yeah. Excellent. Yeah. So, and then that links out, I think, to some documentation on sanitization. PLA, I found a couple of studies that actually show that PLA can be sterilized, you know, and how to do it. And so, you know, because then there was a thing, well, you can't autoclave it, well, which that's true, but there are other ways to. So there's a ton of information out there, but I think that we can say that PLA is safe to sanitize, I mean, can safely be sanitized. And so definitely use it. And I guess the only other thing I would kind of say before is what makers are, you know, the biggest hearted people in the world, right? And they want to be helpful, but always reach out to the community first. As Jeff said, you want to find out what's the need. You don't want to make something and find out that you spent that time and energy on something that really isn't needed in the community. So I think that, you know, Jeff's had the luxury in a sense, and I think he said that, of really working closely with the medical center to determine exactly what they needed. BSU, I know, did it with St. Luke's. You don't always have that luxury. But reaching out and finding that out. But I can tell you almost across the board, if you can do a pocket filter, a mask with a pocket for a filter, those are needed almost everywhere. So super, super helpful stuff. But some great resources out there if you want to dig into it more than you will ever possibly be able to read.
So I also just put in the chat, since Make It trainings are kind of on hold for the moment while I try to figure out what that's going to look like going forward, I have started to gather some state and national resources that I have posted on the Make It page there, and I'll update those as I have time and come across things. But mostly using that as an opportunity to connect library folks with other organizations that are already doing this work. Like I think Alex mentioned, not reinventing the wheel. So I want to give Kristen some time to talk about partnering with the engineering department, and then I also want to make sure that we have time for questions. So take it away, Kristen.
Thanks. So yeah, as I said in the chat, we're kind of 3D printing by proxy. Nick mentioned a lot of chatter from different groups, and we were experiencing that too. So as much as we wanted to kind of do things on our own and you know, take the lead, there was a centralized group in our university kind of that had a lot more production capacity and more ventilation and organization than we did. And so rather than have one of our makers take something home and try and organize, we decided to just lend our printers to the College of Engineering, so that along with some filament, we gave them all of the PLA and PETG that we had, so that they could just kind of centralize and test all at once. So we've done that. The mask they are making is the closed headband with the attached face shield. College of Engineering also has a industrial laser cutter, so they were able to just kind of cut the plastic in bulk. And I don't know where they found it, but the shields that they found still have a protective film attached, and so they were able to just peel back a little bit, attach the headband, and then when they get to where they're going, people can just peel off that film and they're ready to go. So that's been pretty successful. It's weird to think of our printers off being printed without our effort, just because it doesn't feel like we're contributing that much. But I think it's much better to do it this way. It's more organized, it's more centralized. We're minimizing kind of in-person contact, which is what we should be doing. So this was a good choice for us.
Nice, and I like that recognizing that there are different ways that you can contribute, and that sometimes, and I know this can be hard, sometimes letting go and letting somebody else do it is
absolutely
the solution.
Yep.
So I want to open it up to general questions, thoughts, or specific questions. If you have a question for either Erica, Nick, Jeff, or Kristen, has this been helpful?
Erica, we had a question from the group. If someone with a library signs up on your site to say that they're making, should it be one per library, or if there's multiple people from the library making, should each branch group sign up? How would you prefer that?
You know, if they're working together, I mean, if they have a coordinated effort where one person can make sure they're sharing that information out, it's fine to have just one person sign up. Kind of as an example, like Barb up in North Idaho, it's a makerspace, it's a little different, but she has two people, kind of, one's doing sewn masks and one's really focusing on face shields. So we had both of them sign up, because that way it's a little easier for me to target who to email depending on the PPE I'm looking to supply. But it's perfectly fine if they want to have multiple people, but if that's duplicative, just have one person sign up, as long as that's an email that's checked. I am trying to get stuff turned around very quickly, because I mean, I have to tell you, it's very emotional. I had a call from a woman who's a hospice nurse in North Idaho, and she just was in tears. She said, you know, this is my 15-hour day, and I'm, you know, she's with dying patients all day and trying to get families in to see them, and they can't because they don't have masks. And, you know, it's, so it's very important to like quick turnaround. So I'm very, yeah, so whatever's fastest, because I get really frantic. I'm like, let me know if you can help, because it's so emotional, and people are in such great need.
There's a question in the chat about printing specs and infill and all that good stuff. Is that information that is shared somewhere on the website, Erica, or is it just like your standard settings seem to be working?
Yeah, you know, so I have actually I've linked to Jeff's face shields on our website. I had BSU's, but I honestly removed it because they seem to, I honestly didn't dig in to see if they had specs on the face shield. So maybe I should put it back up, Nick, but they were no longer able to provide any beyond what they were doing with St. Luke's. So I didn't want to confuse people. So I don't know. I have not printed a face shield. So I would defer to Jeff, Nick, and certainly Adam in Twin Falls. If you know him, those guys are definitely doing face shields and would know more than I.
So the most recent communication that we had with BSU is that if you can adhere to the disclaimer on their form that you fill out on their website to gain access to the files, then you can continue to use the file that they have. And they had some, I believe there's instructions that are on there. If they're not, general guidelines were, I'm doing that off the top of my head. So I think it was 20% infill with grid. And does that sound right? Okay. And for the version 8 of their file, the one nice thing about the version 8 from BSU is that it's stamped on top with what version number it is, and then it also it'll say if it's PETG, PLA, or ABS, so you can quickly identify what material is being used to print it. So as long as you set it up correctly, obviously. But there's 3 different files, one for each filament type.
Cool, thanks, Nick. And thank you, Kristen, who shared a file and the printer settings in the chat, which don't worry about frantically scribbling that down, folks. I will capture it, and I will share that information. What I'll probably do is put some of the ideas and resources that have been shared in this chat in a document that I will post on the Make It page, and I'll send something out to the Live Idaho listserv once I've done that. Jeff put some information in there as well about the headband that he's been using. So hopefully, I think it was Lewiston that had that question. Hopefully that helps. Cool, I see a head nod, excellent. I know earlier there was a question about how do we make sure we're not recirculating where was that? That was from April. April, I highly recommend, if you have the opportunity, to jump on, I think it's Tuesday's chat. So those of you that joined this one late, the COVID chats are going to have a theme going forward. So this was kind of our first foray into that. And the next theme that we have identified is people wanting and needing to talk about sanitizing, and that in relation to what reopening would look like. And so that is what Tuesday's chat is going to be about. And just like this one, that one will also be recorded. So April, I hope you're okay with me kind of deferring that question to that. What other questions did people have? I'm just scrolling through the chat really quick. Yeah, Kristen.
This just occurred to me, and so some of you may have already thought about it, but we are having, our building is closed, and so many of our employees are at home, and especially for folks that are used to working in access services or do really building specific work, we're kind of, I don't want to say scrambling, but we're trying to come up with projects that are meaningful for them to do, and it occurs to me that we may have some sewers in that group who may be able and willing to sew face masks. So that wasn't something I had thought of. So I will be reaching out to some of our folks and see if they have fabric and would be willing to do that.
You just made Erica's day, I'm sure.
You did, actually.
Yeah.
You know, and Christina, I apologize. You're with UI, correct? So we've had 4 UI grants come through, people applying for grants. So there's kind of different departments, and I have not gotten back to everybody. But so there's funding going to UI, just so you know, and I think that's the face shields mostly. But you know, again, if you guys can collaborate, some of that can also help offset costs of those materials. I did just put in the chat, elastic is the other thing. Like it's just said, it's like gold in this country right now. I do have a source. I'm not going to put it publicly out, but I have a source. So contact me if you really need elastic, 1/4 inch. The buttonhole actually wasn't heard, Jeff. I guess that's a little less used, but the elastic for the masks is, yeah, I have a pound of it right here. I can touch it. I'm going to go deliver this right after we're done. And the other thing is I'm praying, have a source for MERV 16 filter paper by the roll. Right now, people are tearing Filtrete furnace filters apart for the MERV fabric that's in there, because that filters, the MERV 13 filters like 95. It's almost like an N95, not, you know, the MERV 16 is like 99. And so, anyway, so I'm hoping, and if I get that pallet of fabric, that will be something I can ship across the state. I got 50 feet of it donated, and I shipped that north, and have some that I've been disseminating out in the Treasure Valley. But if you need a specific resource, I mean, I may not know, but I may. It's kind of strange, the things I'm finding out now that are completely not usually in my job description. But reach out if you have questions about that. I'm happy to help. And Kristen, let me know. And then, as I said, direct them to the website if they can either collaborate or individually want to sign up. It would be greatly appreciated.
Awesome. And yeah, I had heard April says in the chat, aren't reusable tote bags good for filter material? I had kind of been seeing some of that online as well.
Some. So just check the specs.
Right. Which might be hard to do if it's, you know, a tote, because who doesn't have a bunch of tote bags left over from conferences you've been to? Now's the time to bust into your stash. So I feel like there's been some great resources that have been shared as far as places to go and find materials and files. There are a bajillion different patterns for face masks, for sewing. Erica's team has done a great job of gathering some of those and putting those on the STEM Action Center site. I highly encourage you to poke around there. I also am occasionally putting new resources on the weekly blog from the COVID page. So I'll put the link in there. So there's a blog where staff from ICFL throughout the week are collecting stories that we come across that we think would be useful and relevant to folks in library land. And every Friday we send out the new list gets posted on the ICFL page. There is an option on the COVID info page to subscribe to just that feed. So feel free to do that, or just remember to check the ICFL homepage every Friday. You'll also find the schedule of upcoming chats on that website. I have not updated the descriptions with the themes yet, because that was literally just decided yesterday late in the day, and I haven't had a chance to do that, but stay tuned. So Tuesday's chat, like I said earlier, which is at 10 o'clock, that will focus on cleaning and disinfecting and some initial discussions about reopening and what that might look like in your community, and things to think about. I want to be cognizant of the time. We've got 2 minutes left. Are there any Any final questions that folks have? Was this useful? Does everyone feel like, can I get a yes, this was super useful, I got what I needed? Was this, or is this, oh my God, I'm never gonna get this hour back of my life? Okay, cool. Thanks, Christine. So with that, what I will do is, so this will be recorded. So if you have other staff that you think would find this information that we shared today useful, I will post a link to this recording on the Make It page, and I'll push that out through the Make It Facebook page and through Live Idaho when I've gotten a chance to do that. Included in that will be a list of links to resources and like the STL files and print parameters that folks have shared in the chat. Thank you for those of you that were able to do that so quickly. I also want to thank Erica and Nick and Jeff and Kristen for joining today and being willing to jump on a really vague request that I made of you, and being so willing to share your information and experiences that you've had working in this area so far. Let's see, I'm hoping we engage with more makers. Yep, so Erica is your go-to if you're super jazzed now and want to figure out how you can help out in these efforts. So do please reach out to her. You can also reach out to me, and I will direct you to Erica if you need help making that connection. It was wonderful seeing all of you. Please stay well and stay safe, and hey, keep making.
And stay home.
Yes, that too.
Thanks, everybody. Do
Thank
reach
you,
out. I
everyone.
just put my email in, I think.
In the chat, yeah, you did. And
Yeah,
I'll be sure to capture it.
Don't hesitate to reach out if you have any questions.
For sure. Thank you, Erica.
Bye, guys.
Thanks, everyone. Take care.